It's cold and flu season, and parents want to do everything to protect their little ones. Is it possible to give your children support without the drugs? What is homeopathy, and how does it help everything from infections to behavioral problems to asthma? What are the top 10 homeopathic remedies to keep in the home? Hi, I'm Gabrielle Traub, homeopathic practitioner and owner of San Diego Homeopathy, and this is Parent Savers, episode 33.
Faster than a speeding toddler.
Sit still for just a minute.
Can soothe boo-boos with a gentle kiss.
Would you get down from there?
Able to clean poopy bottoms in a single swipe.
Oh, what did you eat?
Turning frazzled mommies and daddies into procreators of peace and harmony.
Ah, quit touching me.
It's Parent Savers, empowering new parents everywhere.
Welcome to Parent Savers, broadcasting from the Birth Education Center of San Diego. I am your host, Casey Wilt. Parent Savers is all about helping new parents from the baby years through the toddler years. So download the free app, sign up for the free newsletter, like us on Facebook, send us an email, or call our hotline. This is your show, and we want you to be involved. We have amazing experts at our fingertips, so shoot us a line, and we'll get your questions answered. We also have a new option of joining our Parent Savers Club. It's where you can download the archived episodes and get exclusive content and so much more. I'm a new parent. My son Carson is 23 months old, and I'm joined by two new parents here in the studio.
My name is Owen Hemsath. I'm the president of Simple Business Video Marketing in Oceanside. I also have three kids. I have Kanan, who is 5, just started kindergarten. Jameson is 16 months, and Benjamin is 5 months.
5 months. It seems like just yesterday he was born.
I know. And now he's this big, chubby blob, and it's amazing. So I love it.
My name's John O'Reilly. I'm a 38-year-old writer from here in San Diego, and I have 3 boys as well, 5, 3, and 1, and we're all a little bit sick right now, so I'm pretty interested to hear about some remedies that don't involve drugs, too.
Yeah, absolutely.
Keep us healthy.
Today on Parent Savers, our headline, we are talking about Man Sues Ugly Baby Case. Man sues wife over ugly baby. Woman ordered to pay $120,000 judgment. So here's what happened. A Chinese man divorced and then sued his ex-wife for giving birth to what he called an extremely ugly baby girl. So this is horrible.
Oh my gosh.
So first he accused his wife of infidelity, and then because he could never father an attractive child.
Right.
Owens agrees. And so then they did a paternity test. Once it came back that this child was the father's, he then sued his wife on false pretenses for not telling him about the plastic surgery that she had. She admitted in this process that she had undergone $100,000 worth of cosmetic surgery. So he feels duped because he didn't know she was ugly and therefore had an ugly baby. So
poor child.
I know. Well, the kicker is he won, and he agreed. The judge agreed that the ex-wife had to give over $120,000, and he says, "I married my wife out of love, but as soon as we had our first daughter, we began having marital problems. Our daughter was incredibly ugly to the point where it horrified me." Exactly. I part of it is we laugh and we joke and we just can't believe the audacity of this man, but. Oh my gosh! I thought every child was ugly, was beautiful, and if they weren't beautiful,
there are ugly babies, and I think that it's safe to say that's a fact of life. I mean, I don't know if you guys remember the old Seinfeld episode where it's like, wow, that baby is breathtaking, And for the Seinfeld listeners out there, they might remember that episode.
We used to say precious. Oh, precious baby.
You swallow. You say that baby's precious, But I think, to bring it back to reality, we're talking about a country that's not friendly to female babies, and here you have a female baby, and so I think that might have, but maybe there's no legal recourse there, because hey, we can't broadcast that, so we'll go with ugly baby instead of girl baby. You know what I mean?
Well, you know what, I don't know where this was taken, because this could have been a Chinese man in the States. Just because he's Chinese doesn't mean he's in China.
It's hard for me to understand, I guess, the damages of it. I mean, yes, I agree. Some babies probably can be. I mean, right when they're born, they all kind of look exactly the same.
My son looked like my father-in-law. He looked like a 60-year-old man, and he was so ugly. But I admitted it, and I embraced it.
Do you feel like you took monetary damages for that, though?
Yeah, I know. And you know what, though? He's the cutest kid ever. And so it was funny. One of my friends in town here, we had babies at the same time, and her 5-year-old looks at her mom and says, "Mom, baby Carson is cuter than baby Caleb." And my son's baby Carson. person, obviously. And so I told the little 5-year-old,
Obviously.
so I told the little 5-year-old, I said, it's okay because cute babies make ugly adults and ugly babies make cute adults. So
that's science. It's science. I think that the plastic surgery is where you get into. It's like, what, you know.
So you say if your wife, you didn't know she was as beautiful as she was, then
Look, this is silly. This is a silly thing here, and I hear the headline and I'm thinking, oh, that's got to be the U.S. I mean, we're like the most litigious country out there. But to hear it, well, okay, she got plastic surgery, didn't tell you about it. I mean, that's a big deal. That's like saying, oh, by the way, I was once a man, but I had some plastic surgery.
That's extreme because I mean, maybe she just got her nose and her eyes open.
It could be, but we don't know.
If if you can tell from the moment the baby's born that, oh man, she was ugly, she probably had a lot of work done.
And you know what?
But she could cook.
She got her work done in South Korea, and it was $100,000, and we've lived in South Korea, and $100,000 gets you, she could probably have turned from a man to a woman plus some.
She could have been a zebra. I mean, for that, we don't know.
Basically.
But I think if the work got done in South Korea, I think that we're talking about a Chinese couple. I think that points to that, and who knows what the system is like.
Blame
over
it
there.
off on culture.
It's something we don't understand.
We posted this on Pinterest, so repin it if you like it or join our discussion there. Today on Parent Savers, we have Gabrielle Traub, homeopathic practitioner, here with us to discuss how we can use homeopathy in our children. So what is homeopathy?
Well, I wish I could say that it makes people look more beautiful, but it doesn't. But it definitely helps in other ways. So homeopathy was actually developed about 250 years ago by a German physician. His name was Dr. Hahnemann. And what the wonderful thing about homeopathy is, and what parents really love about it, is it's so incredibly safe. It's so safe, in fact, that I've actually given homeopathic remedies to babies, newborns that are just a few minutes old, and to the elderly, and throughout pregnancy. It really is the ideal form of medicine because it is so safe. And I'll give you some examples of how homeopathy works. What homeopathic remedies do is they actually work with your own body. They trigger an immune response. So I'll give you an example of this. A lot of children these days have allergies. Allergies is an epidemic.
Oh, and it's totally coming now in the fall.
Yeah.
Yeah, I mean, it's just astounding to me why government health officials aren't exploring the data more and trying to figure out why this is.
You mean like peanut allergies and stuff too? Those types are...
All types of allergies.
Yeah. Okay.
And we can go into that in more detail because I have my own theories about why that is.
Okay.
But what allergy treatments do, traditional allergy shots, are that allergists give children or adults small doses of the substance that they're allergic to, and this creates this type of desensitization that over time they become less and less allergic to that original substance. And this was actually borrowed from homeopathy. This is essentially what we're doing in homeopathy. It's actually really interesting. In Europe a few years ago, there was a new treatment called sublingual immunoglobulin therapy. And what this is instead of giving allergy shots as an injection, they just give the same substance that somebody's allergic to in small dilutions underneath the tongue. And this has become very, very popular in Europe because, first of all, you don't have to give your child a shot. But second of all, because there are fewer mast cells sublingually under the tongue, there's fewer side effects. And everybody's raving about this latest and greatest technique. And homeopaths are looking at each other and thinking, what is wrong with them? This is homeopathy. It's been around for 250 years.
Well, that's how they did vaccines and stuff for...
I think inoculations is what you mean.
Yeah.
I'm so glad you brought that out because a lot of people don't realize that the first official
That's
vaccine...
what I'm saying. The very first official vaccine, that's what they did, which was...
Edward Jenner, he actually... and he was actually a homeopath. And what he actually did was even more homeopathic than the way we give vaccinations today. What he gave was he gave cowpox vaccine to vaccinate against smallpox. Cowpox is a very mild illness. Smallpox is a very deathly, severe illness. And he actually gave something similar, not their exact. And this is a beautiful distinction of what homeopathy is. We give a similar virus that is either slightly weakened or attenuated in their pathological experience. So that the smallpox vaccine is actually the most purely homeopathic vaccine we have. These days, however, when we do give the smallpox vaccine, we're still giving it to Marines and our Army. It's really horrible. We're actually not doing it the way Jenna did. We're not giving cowpox. We're actually giving smallpox itself, which is dangerous on so many different levels. But that really is what homeopathy is. You give something similar, not exactly the same. And that's essentially the biggest difference between homeopathy and traditional allergy medicines. The way allergy medicines are given is something called isopathic. You give the same. And that's beautiful, and it works well for desensitizing against a specific problem, like a specific protein. However, that doesn't give a broad general a boost to the immune system. And most children who are allergic to not just one factor, but multiple factors. So when we give a homeopathic remedy, we're not just giving that allergen, we actually take into consideration other factors like the child's likes, dislikes, food cravings, physical appearance, personality. It's a very holistic approach. And what this actually does is it moderates and regulates the immune system to give more of a broad reaction to all allergens and regulate the immunity as a whole.
So now we're in the season of flu and cold. How specifically will homeopathy work for the immunity for babies and kids? What would you do there?
There's a number of different approaches. My favorite and best, the highest approach, is to do what we call constitutional homeopathic treatment. And that's what I was referring to earlier, taking into account the whole constitution of the patient, their likes, their dislikes, their physical morphology, everything like that. And that's actually a good way to prevent. Another method that homeopaths use is they actually give small doses of the influenzainum virus throughout the flu season, approximately once a week. So we give actually homeopathic dilutions of influenzainum, that's what it's called, once a week, and this can help to protect against the influenza virus. Some of my patients, however, have reported slight reactions to that if it's a low dose, beyond Avogadro's number, like a mild fever or some cold symptoms. The best way as well is to nip it in the bud. So the moment that your child gets sick, to give a homeopathic remedy as soon as possible. And I'm actually going to be talking about some of those remedies, the top 10 remedies to keep in the home.
I'm looking forward to that.
Now, can I ask a question for some of the skeptics out there? Is, what is your training and your position? You're a homeopathic doctor. How does that work?
Well, I'm actually trained in South Africa. In South Africa, we go through medical training like a medical doctor does, and I spend a year doing research, double-blind clinical trials. The training in the U.S. is a little different. Many countries in the world, to be a homeopath, you have to be trained like a medical doctor. I actually teach at a few schools here in the U.S. that are excellent schools. It's generally a 3-year part-time training, and there is actually the first homeopathic medical school that opened up in Arizona 2 years ago. So in the United States, homeopaths are not considered as doctors. The way I work around that is I actually work in a doctor's office. I work in an OBGYN clinic.
Okay.
So I work very closely with OBGYN, and we have nurses. So I like to, because my training is very medical, I like to integrate the two.
Yeah.
I think that's very, very important. And many people don't realize how many research studies are done on homeopathy. There's plethora of research. I myself conducted double-blind clinical trials, and I actually have collected over the years a huge database of research studies on pretty much everything, especially relating to children.
So it's not like you take a 3-month course and then you're a homeopathic practitioner.
Absolutely
you go to all this
not.
schooling for it. Wow.
But
I think that's an important distinction too, because I'm not looking at, just for the listeners out there, what I'm not looking at is, kind of a beach hippie. I'm looking at a professional female, who's speaks very well and carries herself very well.
Thank you.
I'm not, because I think that with I personally, I see a naturopath, and I'm very much an advocate of homeopathy. I'm very much anti-medical when it comes to treating symptoms instead of the cause. And obviously, we're not opposed to antibiotics and things like that, but preventative medicine and things like that. So I want the audience to really understand that this is something that's medical. This is something that is empirical. It's objective. And the results really do speak for themselves.
Thank you so much for saying that, and I highly agree completely. But I do want to say one thing, is that my goal is to bring homeopathy into every home and have almost every family have someone who's knowledgeable about homeopathy. So there's definitely the mom in the family or the dad in the family can be the family homeopath, because homeopathy is so safe. There's very little you can do wrong. It's very forgiving.
And we're not talking about, you say, you're having a general knowledge in the home. You're not talking about, training someone in biology. You're training somebody in the facts and what works and how to access resources.
Exactly. And so if your kitty falls or if you get a cold, moms can reach for their homeopathic first aid kits and nip it in the bud and give a homeopathic remedy. And only if it's severe or progresses, then they need to go to a homeopath or their pediatrician.
What are some other things that moms can look at with their kids to, go to homeopathy first? Behavioral problems, will it work with that? Is it infections? Is it more things that should be treated? Or what's kind of, I guess, the gamut or some of the big things for parents to look for?
The wonderful thing about homeopathy is the scope. It really has a huge dynamic scope. And I myself did double-blind clinical trials on what I call thought interference, nervousness, and anxiety, which is more in the behavioral realm. And I actually worked in an inpatient treatment center for a number of years for psychological conditions such as eating disorders, chronic pain, addictions, post-traumatic stress disorder. So it really has a beautiful scope of action on the psychological aspect. And I do get a lot of referrals from psychiatrists and work together with them. And, I really believe in integrative medicine. I really don't believe in one being superior than the other. Each one has its place. And when they work together, that's the ideal situation. I would never tell parents to give up their pediatrician and just go all natural. That's not a sound solution.
And I think that when people hear, not everybody, but I think when some people hear things like homeopathy or holistic wellness, that's what they think. They think about like tree huggers, if you will.
I like to hug trees once in a while. I'm just
right? And I think they think,
it's one way or the other.
Yeah, hemp clothes, barefoot. You know what I mean? Yeah, exactly. And that's
nothing wrong with that.
Right.
But the stigma that homeopathy has to being like hemp clothing and tree hugging, that's a very Californian concept. In many countries around the world, like the homeopath is considered such a noble profession. It just has a different perception. It's interesting. It's really actually humorous for me. So, I like to tease people a little bit when they do make comments.
Silly
like
Americans.
Silly California.
Oh, you had also said to me in an email that it can help with autism and other behavioral problems like that.
There's actually a NASA engineer. Her son developed autism. Her name is Amy Lansky, and this mom tried everything. And she has a very analytical brain, being a NASA engineer. Mm-hmm. And her son was cured with homeopathy. And she was so intrigued by this whole process. She actually went on to write an excellent book. If any moms have children or dads have children with autism, this book is called Impossible Cure by Amy Lansky, and she then went on to become a homeopath. And the incidence, the prevalence of autism is increasing at such an alarming rate. It's become so significant that this is something that I see in my practice all the time and anticipate will increase in the near future.
Great. And we also have a homeopathic kit to give away, so stay tuned for details. When we come back, we'll talk about the top 10 homeopathic remedies to keep in the home. We'll be back. We're back on Parent Savers with Gabrielle Traub, homeopathic practitioner, here with us to discuss how homeopathy in our children works. So what is constitutional homeopathic treatment, and what can it do?
For those of you who have just joined us, what I was talking about a little bit earlier is constitutional homeopathic treatment is when you take into account the whole person. In homeopaths, I'll predominance, well, let me backtrack. In psychology, the predominance is on the mental and emotional, the behavioral. And in classic medicine and conventional medicine, the emphasis is on the physical. In homeopathy, we don't really give each extra weight. We look at what's presenting at this moment in time. Some patients are very balanced emotionally and all their symptoms are on the physical level. Some patients are very healthy physically, but their problems are all on the behavioral level. We have oppositional defiance, ADD, ADHD.
Oppositional defiance, that's my 2-year-old. Is he too young?
Well, he's also going through the terrible too, so it's...
But maybe when they get to be a little bit older and they're having, issues with maybe.
There are amazing things that you can do with homeopathy. It doesn't change the personality of the child. Nothing will change your child. Children often ask me, will this change who I am? No, it won't. What it does, it just creates balance, and it's a really beautiful process. I love treating kiddies from when they're really, really young, and children become really in tune with what they need. The dosage system with homeopathy is really about giving the remedy not on an ongoing basis, but we identify certain red flags to see when your child is out of balance. And these children actually become so in tune with themselves that they'll know when they need their remedy, and they'll often ask, "Mommy, I need some pulsatilla now," like a homeopathic remedy. It's so cute seeing these little kids so aware. Yeah, I love that.
My mom used to say it to me, "You need your B vitamin right now," and that's because I was being hormonal. And that
We're getting a question in on the Twitter feed here, and so if you're on Twitter or following us on social media, you can check in at the hashtags Parent Savers or Parenting. The question is, what does homeopathic medicine look like?
Okay, there are many different forms of homeopathic medicines. It comes in injectables, sublingual pill forms, tablets, a variety of different pill size, liquid, suppositories, creams. It comes in many different forms. Because we treat so many children, and because children aren't so excited about taking cough mixture, they're more excited about taking homeopathic remedies, we use these little white pills. And the pills taste sweet, and the reason they taste sweet is because they contain lactose. Depending on the way the medicine's prepared, depending on the pharmaceutical company, they either impregnate it into the pill, or many times, actually, they just coat it on the outside. And that's why we say don't touch the pills with your finger. We just don't want you wiping off all the active ingredient, and most children have no problem.
The active ingredient or the tasteful ingredient? I missed that. I did.
So the active ingredient, depending on the way the pill is produced, is usually on the outside.
Got it. Okay.
So you don't want to touch it with your fingers because you don't want to wipe off all the actually.
And these little white pills, they're it's smaller than a Tic Tac, and it's quick dissolving, right?
You get different pill size, but the ones that are more readily available over the counter are really tiny. A lot of parents worry about their children choking, and babies, I don't even know how to describe this on radio. You just go pop up the lower front lip and
You kind of pinch the lower lip there and
pop in a pill. You just need 1 or 2 pills, and they dissolve so quickly you don't need to worry about choking. However, parents who are worried about choking or are worried about the lactose, you can actually find the medicines in a liquid form as well.
And you have things for even teething. That's how I discovered you.
Yeah.
So you can do it for teething and for earaches and all sorts of stuff. Is this something that you need to go to a practitioner to put in your medicine cabinet, or go to the store to get?
I recommend for everyday things like cuts and colds and knocks and bumps. Moms can definitely treat things like this on their own. When it comes to more chronic conditions, for example, if they have recurrent ear infections, and there's actually been beautiful research that's been done to show the effectivity of homeopathy with recurrent ear conditions, I would say that for that type of situation, it's best to go see a homeopath. And these days, it's so easy to find a homeopath in your area.
So what are things that families can keep in the home that are interested in?
You have a top 10 list.
Exactly.
So.
Oh, great. Okay. So
I gotta get my pen out.
This is kind of my dream. I would love every single home to have 10 homeopathic remedies. And you can actually go to your health food store. A lot of them sell a homeopathic first aid kit, or you can just buy one at a time and slowly build your own little kit. Most people have heard of Arnica montana. This is a wonderful remedy.
Can you spell that?
Arnica, Arnica.
Okay.
I don't know if it's possible to post these on your website, the top 10.
That's good. That way, you just spelled it for me, but we'll post it on our website. So Arnica, what does Arnica do?
Arnica is excellent for bumps, injuries, swelling, bruises.
So if your child gets, I've heard about this drug. My child gets, he falls down all the time. He's a boy. And someone told me there's something that you can rub on their spot where they fell that'll help the bruising.
It works amazingly.
Wow.
If it's like a very localized area, then just rub it on. You have arnica gel or cream or ointments. If the child actually hurts themselves and it's more systemic, then actually it's better to take the pill form internally, or you can do both. And I don't know what my home would do without arnica. We're always in the wall, so it's really great to have that remedy on hand. And you can use it for animals too, and not just for kitties. You can use it for moms and dads as well.
Wow. Okay, number 2.
Aconite. Aconite is a great remedy actually for colds and flu, so wonderful this time of year. The significant thing about aconite is it's not the types of colds and flus that develop slowly. It's not you see your child slowly getting sick. It happens suddenly, and it needs to be used within the first 24 hours of onset. That's why I recommend keeping it in the home. The fever is high, the child is thirsty, they're anxious, they're restless, and colds and flus often come after exposure to cold, dry wind, like after going out in Halloween and trick-and-treating and the weather changes and it becomes cold. They can also come on after frights or shocks. So maybe a dog barks at them, the child gets scared, and the next day they're sick. Give aconite immediately. Beautiful remedy. Number 3 is belladonna. Belladonna actually means beautiful lady because they used to use it by putting belladonna drops in the eyes. It's made from atropine and the pupils dilate. And according to surveys, men perceived women as more beautiful according to how dilated their pupils were.
All those single parents.
We study that in media though too, and that's why cartoon characters have bigger eyes, and that's why the old Chinese artists would emphasize the woman's eyes.
So why
That's
do
very
I need
interesting.
bigger pupils?
You don't need bigger pupils. What? Your pupils are perfect.
Thank you. Thank you for the compliment.
So your husband,
Tell me more about that.
So belladonna is actually used in kids and adults for very high fevers, and the cheeks are bright red. This is also really good for ear infections where the eardrum, the membrane, the tympanic membrane is bright red, bulging, throbbing, and it also they often crave lemonade. This is the type of very high fevers. In fact, even the ones that can produce potentially seizures or hallucinations. Obviously, in that situation, please don't wait at home. Always go see your pediatrician.
What about roseola? Because I know that a lot of my friends are going through that now, and it's a high fever and then the rash.
Absolutely. And with belladonna, just like aconite, and belladonna in the olden days was actually, roseola is similar, was actually almost specific for scarlet fever. So these types of conditions, absolutely. With belladonna, again, the fever becomes high quickly. These are very good for children who are normally very healthy, robust, strong children, and they get sick very quickly. So that's another remedy to keep in your at home. Number 4, hypericum. Hypericum is beautiful remedy, and I hope this never happens to you, but it's good for crush injuries. So for example, you step on your baby's toe, or especially the like nerve-rich areas like the fingertips, the toes, the nose, the tongue, even the genitals. So it's a good remedy if any of your children have circumcision. It's also a good remedy for nerve pains, very nervy pains, sciatica, shingles, that type of thing. Calendula, that's actually made from the marigold. It's a herb, but it's also a homeopathic remedy.
I've heard that. That's in all the new baby lotions nowadays.
It is a beautiful remedy for cuts and colds. Cuts and scrapes and abrasions. It's also excellent for moms postpartum. We actually have homeopathic pregnancy kits for delivery and postpartum, but for the mom and for the baby, it's a little bit of a shock and a trauma, so using calendula can be very helpful. Apis mellifica is number 6, and this is a remedy made from bee venom, and we use it for insect bites, especially bee stings. And obviously, if your child is allergic, you always need to keep an EpiPen at home. But for any type of bee stings, Apis is a beautiful remedy, and it's good to keep in the home. Number 7 is ledum. Ledum, hopefully none of your children will ever experience this, but ledum is good for either a black eye, or if they occasionally bump their eyes, or also for puncture wounds. So, something like a splinter. We actually have a better remedy. Silica helps to almost expel like a foreign body from inside.
So would you use this one over black eye over the first one, the
arnica? That's a good question. Generally with arnica, the inflammatory process is very active. There's lots of heat, swelling, inflammation. With the ledum, the area feels cold to the touch. There's less inflammation. The bruises are more black or green or blue. So it's less of an inflammatory process. So arnica first, ledum would be maybe the secondary phase.
And what's our number 8?
Arsenicum album. This is a beautiful remedy for food poisoning or diarrhea. Now, obviously, if your child has food poisoning or diarrhea, it's always wise to take them to their pediatrician. What's very dangerous about food poisoning or diarrhea is dehydration. It's really important that they get enough fluid and electrolytes. However, on the way to taking your child to the pediatrician, I've had a mom had a very severe allergic reaction, and in the car, while she's taken to the pediatrician, she gave Apis, the bee venom, which is also used for allergic reactions. And by the time she got to the pediatrician, it was gone. So you can actually, if you give these remedies in the moment quickly, while you're getting help, they can actually be helpful in that situation. Ignatia amara. Now this is different from Echinacea. Ignatia is like the Saint Ignatia.
Okay.
It's the Luganaceae plant family, and this is a beautiful remedy for any type of grief. So any kind of loss. So if a child loses their favorite pet, or
postpartum depression, we have other remedies for that too, like sepia is a more hormonal grief remedy. But especially after a loss or grief, or if unfortunately you lose your baby, Ignatia is our famous grief remedy, and it is just a beautiful remedy. The last one, number 10, is gelsemium. I hope I'm not overwhelming the listeners. I know. I'm like, what are these names? They sound like planets.
Gelsemium is actually made from the yellow jasmine. I'll use the common names. Yellow jasmine. And gelsemium is a beautiful cold and flu remedy. But when we talked about aconite and belladonna being the onset was very fast, for gelsemium, this is actually the cold and flu remedy that I'm seeing most this time of year right now. The last few weeks I've treated so many patients with gelsemium, is they get sick very slowly. It's like a gradual onset. Their eyelids become very, very heavy, and they're feeling just really weak and lethargic and more like confused, and they're not so thirsty. These are the indications for gelsemium. Gelsemium is also a great remedy for stage fright. If your kid's in a school play and they don't want to go up on stage and they kind of just become paralyzed with fear and shock, it's a beautiful
what
remedy.
I've learned from all this is that there's something for everything.
There is.
Great. I'm going to take my son to you after this episode. Thanks so much to Gabrielle Traub for helping us learn about homeopathy. If you want more information, go to today's show on our episodes page on our website, or visit SanDiegoHomeopathy.com. We actually have a free giveaway homeopathy kit for your home. So this is how we're going to do it. If you want this kit, go to our website, go to this page on homeopathy, and write in the comments section why you want to use homeopathy or how you use homeopathy, and let us know, and we will give this kit away at random. Thank you so much. Our conversation will continue with Gabrielle after the show for our Parent Savers Club members, and see our website to sign up for the club.
Hi, Parent Savers. This is the Daddy Complex. I'm David Viana, father of twin boys, and if my experience has taught me anything about parenting, it's that I know nothing about parenting. You will become your dad. Please understand this doesn't apply to everyone. In fact, this is a sweeping generalization, so if the preceding statement offends you, please Google the words cat and video. You'll find plenty of things to keep you busy while I continue. Anyway, becoming my dad seems to be true in my case, and as I've said, though I like to think I'm a unique little snowflake, my experiences seem to be rather common. My dad is a pretty rad guy, but I didn't always know that. In fact, when I was young, we didn't really get each other at all. Seriously, we were like oil and water if oil listened to Berkeley punk music and water enjoyed travel shows. And I do think that every boy has a stage in which he desperately tries to distinguish himself from his father. Look at Martin and Charlie Sheen, for example. Martin is a smart, talented political activist. Charlie is a whoring drug addict who can't even convincingly play himself. Around the time I graduated college, however, I started to have real-world experiences. I started to see the wisdom my dad tried so hard to impart fit within that world. Similarly, I think he started to see how I could forge my own path, even if that included much more facial hair than he's comfortable with. Now that I have kids of my own, I find myself quoting him often and doing things as he might have done them. And I finally realized the decisions he made that I didn't agree with or didn't understand when I was young were done so in an effort to protect or help me. And if wanting to make my child's life better makes me like my dad, then yes, I'm exactly like my dad. Check out more of my terrible advice at thedaddycomplex.com, the Huffington Post, or on Twitter at thedaddycomplex. You can also view episodes of Fighting with Babies, my puppet web series for parents, at thedaddycomplex.com/FWB. And be sure to keep listening to Parent Savers for more fatherly tips.
That wraps up today's episode. We'd love to hear from you. If you have any questions for our expert about today's show or the topics we discussed, call our Parent Savers hotline at 619-866-4775 or send us an email through our website, parentsavers.com, or Facebook page, and we'll answer your question in an upcoming episode. Don't forget to tune in to the Behind the Scenes Parent Savers Club to keep listening. Thanks for listening to Parent Savers, empowering new parents everywhere.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.